Tell me about the importance of a conference like this to you as someone who is in the field of child and maternal health.
I think it's been a really great conference. I think to me, it's just been exposed to all the ideas from the other researchers and people who've presented. The exchange of ideas has just been amazing. Just overall, just very stimulating. You just leave a conference like this with a lot of great ideas.
What do you marvel at the most of the changes in children maternal health and preemies and prenatal care, and what's been the greatest leap, and where are the biggest gaps?
I guess I'll just talk about the area that I'm working in at the moment. I'm working in the area of retinopathy of prematurity, which is an eye disease, a complication of preterm birth, low birth weight. And I think we have really made a lot of advances in the last few decades, in treating babies who have this very adverse outcome of prematurity. But obviously we still have a long way to go. We could still do better. But it's still one of the leading causes of childhood blindness. But we're certainly doing a lot better than we were several years ago.
And what's going to push the path forward? Where's the greatest? Is it going to be on big data? Is it going to be on? Is it going to be? What's going to propel that?
So that's a good question because I work in the area of epidemiology, and you can either work with big data or you can have small databases. So I think big data is good if you want to look at big outcomes where you're just very sure about your outcome. But if you want to fine tune something and really, just dig a little deeper, you may do better with a smaller data set, providing, of course, you have adequate numbers and you're adequately powered. But I think you have the ability to answer maybe some more detailed research questions if you have a smaller data set.
Can you talk about inflammation, because your team has done studies indicating that inflammation plays a strong role in the mechanism of preterm?
Right. So I was very interested in examining the contribution of the complement system, activation of the complement system, to preterm birth. So what I did was I designed a study where we collected blood samples very early in pregnancy, like just a little bit outside the first trimester. And we measured a certain activation fragment called BB in early pregnancy, and we found that women who had an elevated level of this activation fragment were more likely to have a preterm birth, less than 34 weeks gestation, as compared to women who had a preterm birth a little later on, or to women who had a term delivery. So I think, to me, the results of that study signify that there are some inflammatory events that are subclinical, we're not aware of them, in early pregnancy that place a woman at an elevated risk of preterm birth. And of course, we're only talking about one component of the inflammatory system. I just looked at one area. There are many, many other areas as well.
And what could those inflammatory situations be? What's the breadth of what they could be?
So that's a good question. Obviously, when you think about inflammation, you think about infection. So, you have an inflammatory response to an infection. But in fact, you can also have non-microbial causes of inflammation. So in early pregnancy, if you have like necrotic tissue in the placenta, or if you have dying cells, any kind of other insult can actually provoke the inflammatory response. So we're not sure. We know some of these preterm births are related to infection, but it is possible that they could also be related to non-microbial causes, such as damaged tissue.
Now, the two words that were put together today in an earlier presentation were metabolism and inflammation. Did those resonate for you?
Yeah, so when I think about metabolism, and I think about, obesity obviously is a big problem in pregnancy at the moment. And in fact, I have done some work where we have looked at the influence of maternal BMI in preterm birth, and we found that women who are at the extremes of BMI, so it's not just women who are obese, but actually women who have inadequate weight gain or who are very thin going into pregnancy, they are also at risk of a preterm birth. So, You know, it's all very complex. We have the interaction of all these different causal pathways, and it's just hard to tease out exactly what's going on. But I think what we've learned from the conference today is that I think a lot of people are really feeling that inflammation is very important.
Does the complexity make you in awe of what goes on?
It is a little daunting at times when you're trying to tease out what exactly is going on. But I think, you know, my area at the moment is looking at the extreme preterm birth. So the babies that are born less than 31 weeks gestation or who have a very low birth weight of less than 1,500 grams. So these are these really tiny premature babies. And I don't know, I feel a certain passion that we really need to work out why these babies are arriving, you know, too early into the world, because they have a very hard entry into the world, and then their neonatal course is also very complex. And I feel we really need to target our research on those babies. And what we know about those babies is a lot of those babies actually have signs of infection, inflammation.
And how does proteomic analysis fit into that?
So I became involved in proteomic analysis maybe 2 or 3 years ago. So the power of this is the fact that when I did my original complement study, we just looked at one protein in early pregnancy and so it was related to a preterm birth later on. But with proteomic analysis, we have the power to look at, for instance, I discussed over 1,000 proteins this morning. We call it a discovery approach. So we're able to see, are there any other proteins that actually become manifest as a part of this technology that may lead us to discovering newer signaling pathways for preterm birth. So in fact, what I presented this morning was the fact that when we reran our analysis using proteomics, we found very similar results to when we had looked at just that one protein. So it was kind of comforting to me that we were able to validate the fact that our complement protein was also elevated when we did the second analysis. And in addition to that, we were able to see other proteins as well that were important on the preterm birth pathway. So,
and what fuels your passion?
I've always been very interested in perinatal research, I think, from the time I was a medical student. And then I became, you know, became more interested on the research side of it. I'm just very interested in finding causes why things go so wrong. And also I really feel for these babies. I think they have a very difficult life. We've heard at the conference today all the adverse outcomes they have to encounter. They have a lot of challenges in life.
And long-term into adulthood.
Absolutely, yeah. So what we really want to do is, you know, make a difference for these children. And of course their moms have difficult labours. And it can be very frightening having a preterm birth. I mean, like one of the investigators today was discussing, you know, she gave the example of a woman who, you know, just gets preeclampsia, which is a hypertensive disease of pregnancy, finds herself in the hospital, you know, delivering like a 28-week gestation baby. And that's even really terrifying for a mom as well. So it's both an adverse issue for both the mother and the baby. So I just feel very passionate about trying to make a difference. And at the moment, I'm really involved in retinopathy of prematurity because I think, you know, blindness in children is very hard to take. And
that's lack of oxygen. Is that the major
it's
impact?
Complex as well. I mean, oxygen is implicated, but really it's gestational age, low birth weight, oxygen. We have to be very careful how much oxygen these little babies get. And then the other problem we're dealing with is the fact that they're born early, so we have a loss of what we call the maternal-fetal interaction. So they're missing certain growth factors and other factors from the mom, which also affects the development of the retina.
I'm not going to use this, but the support trial, the significant trial on oxygenation.
Right.
What did you think of the controversy
Not
of that?
really an area, you know, I'm not a neonatologist, so I don't think I can really comment on that. But I mean, what I have heard about that trial is that, you know, it's just been very difficult to find out exactly how much oxygen is safe
Right.
in these babies. But I really do think our neonatologists are doing a terrific job. We just ran statistics from our own group, our own cohort in Colorado, and we found we have a very low incidence really of high-grade ROP, which is good, which means that, you know, we're doing good in the NICUs.
What do you think will be the greatest catalyst for future breakthroughs in research in your field?
That's a good question. I think we need more research funding, that's for sure. I think
Federal dollars?
absolutely, yeah. We need to really tackle this issue of preterm birth. I don't think we're putting adequate funds into it at all. It's great to be here today and just, you know, feel the passion of all these other researchers who are working so hard to make a difference for this really bad outcome of pregnancy. But I think they need more research dollars. We need more research. We need to get some more young investigators into this area, both on the maternal-fetal side and also on the neonatal side and the basic science as well, you know, placenta. We just need more of these multidisciplinary teams that we've seen presentations from today. I think that's the only way to go. I'm trying to do that in Colorado at the moment. We have a great group of pediatric ophthalmologists, but we're also engaging also our neonatal colleagues and our pediatricians, statisticians, MFM. I'm trying to bring all of these groups together. And anybody who's actually interested in perinatal research with some focus on retinopathy of prematurity. And it's great just to get all of these researchers together talking about the issues, and they kind of stimulate one another.
Great.
So
Thank you.
it's good.
Thanks a lot.
Okay.